Hi, I'm Dr. Seth Barr, and this is Dr. Tyler Reed, and we're going to go through the protocol on how to use the Rebuilder for at home. So I'm going to be the patient. Dr. Reed's going to show you how to set this up on me, and you can follow along step by step to make sure that you're doing this properly.
All right, so you've already received one of these, and we'll go ahead and open it and show you how to access all of the contents here. So here's the Rebuilder sitting in there. It already has a battery in there, so you should be good to go there. And inside this zipped portion, you're going to find the cords and you're going to find some sticky pads. All right. We'll also be giving you a bag of sticky pads as well, which I'll get to here in a moment. But you're going to access these two cords here. I'm going to step off out of the screen here for a moment, but then we're going to grab one. Now, the easy way to remember this is foot to foot, knee to knee. All right. So we're going to be putting pads on your feet and pads on your knees. All right. So the little gray circle here that is the front side of this. So you don't want to, you'll notice that there's different, it's a different shape. So you don't want to be jamming it in the opposite way. So just be careful with that. The gray dot is on the front side of this. So just like that, you see the gray dot. You're going to do the same thing on for both cords, okay? So what I'm going to do here with Dr. Barr is get out the sticky pads, which you'll get a bunch of these because you're gonna go through them. I'll open them up. You pull the tab off, get the sticky pads out, and we're going to use two of them, one for each foot here for this first channel. I'll come up close here in a second and show you.
And it does go in kind of firm, so if you want to show them a little closer on the camera, how that goes in there.
Pushing that directly in all the way so the black meets the end of the white there. All right. So we're going foot to foot. So we're going to put the first one right at the ball of the foot here, just below the toes. And the same thing on the other foot. All right, same thing on the other foot. This peels off this cover here. So we got both feet right there. All right. They're both attached. All right. Now we're going to do knee to knee for the other channel. All right. So we're going to go really anywhere around the knee, but inside of the knee, or another good, some people have hairier legs. So you can find a less hairy area is fine as well.
Sometimes the back of the knee works well. And so while he's getting this ready, I just want to clarify that this is very important. So one cord will go to the foot and to the other foot. The other cord will go to the knee and to the other knee. So when he says foot to foot, knee to knee, one cord goes to both feet and then the other cord goes to both knees. That's very important that you set it up this way.
So then I'm going here, poking those in, and I've got the other channel going to the knee and one channel to the feet. So two separate ones. We don't want to cross, as he mentioned. And this device is automatically set up for 30 minutes. All right. So we do recommend for some patients, maybe start out at 20 minutes, and then you'll just have to shut it off just to make sure that you build up the tolerance as well as you don't have any aggravations or anything. We don't see that often, but just as in an abundance of caution. So we do go ahead and turn that on, and you'll see the lights light up and it starts blinking. So you turn both dials on. And some of you watching this video might not feel this at all. We might crank it all the way to 10, which you don't need to, but we'll crank it all the way up and you won't feel it at all. It is working. And the important part is you just do the treatment. So we don't need to crank this all the way to 10. As I mentioned, 5, 6, you're getting the same frequency regardless of if it's on level 1 or level all the way up to level 10, right? So the nerves are getting the same healing, the same re-educating, the same stimulation, regardless of how intense you might feel it.
And how intense should they have it initially?
Again, you might not notice it at all, but you don't want to be zapping the heck out of your feet, right? It's going to overstimulate these damaged nerves already and send you into more aggravated states. So you might barely feel it, kind of tickling, very, very light stimulation. or again, you might not feel much at all. But if you ever want to know if it's working, often people can touch it with their hands, but it is working. So it runs on a 9-volt battery. So if the battery runs out, you can easily replace that. The batteries usually last quite a while though. So when it turns off after that 30 minutes, or if you turn it off after 20 minutes, just go ahead and you turn it off all the way, the dials, and then you can see it stops blinking those green lights.
Couple things when you do this, it's going to help to have you lay down and actually have your feet on a pillow elevated. It's not necessary, but what we've found is that by doing that, it actually helps blood flow drain out of the legs. It actually helps lymph drain out of the legs, so you get better results. Again, if you're traveling or something like that, or can only do it in a chair, that's fine. But to get the best results, we really would like you guys to make sure that you're lying down and the feet are elevated above your heart when you're doing this for the best results.
I did want to mention as well, you might have been recommended, depending on your case and your needs, you might have been recommended a light device, a red light device. Now you'll be able to do that device concurrent to this. So set this up, get it going, and then you can do either the boots, or if we give you a different light device, you can do that, which we'll also go through in a separate video. So you'll have that, but you can do it at the same time. So no problem with putting the boot over the pads or anything like that. You just do it together. That way it's going to save you time at home doing these treatments that you need. So again, 30 minutes. This is how you set it up, foot to foot, knee to knee. You will move through some of these pads over time. Usually the pads might last 4 or 5 uses, and then you'll have to cycle into the next one because our skin and the oils and everything, they lose their stick so over time. So did want to just briefly touch on as well, for some patients we tend to use this more often, but for some patients we might use a knee strap, and you'll get 2 of these, and it works exactly the same as these sticky pads for the knees, except for it's a knee strap. So this thing actually unstraps fully if you'd like to, otherwise you could slide your leg through, and it comes around the same thing. There's actually a little area here where it pokes into a hole on the knee strap. Now with this, it works nice if somebody's got hairier legs or something like that, where the sticky pads are challenging. We actually use a conductor spray, and you see this gray silver area here. We spray that down, and then just like everything else is the same, we strap that around, and it's Velcro, so you're going to get it kind of snug there, and you're ready to go. So same thing as the sticky pads, just using a knee strap in replacement of that. And then same thing on the other side, of course. So you get 2 of those.
And one other thing with these sticky pads, like he said, you're not using a new sticky pad every treatment. These might last 5 treatments, sometimes they'll last a little longer, weeks in some cases. So just save that plastic sheet, because when you're done with it, you can just put this right back on that plastic sheet there, and then you can use it next time. And you'll kind of know when they wear out, they lose their stickiness, they don't get as good of a conductivity with it. So yeah.
So that is the Rebuilder. So this is going to re-educate your nerves, going to help your nerves heal, get those nerves firing again in a lot of cases, and have you on the way towards feeling much better very soon. So watch the other videos you might have attached, and always shoot us any questions that you have. Talk soon.